in regards to the dengue outbreak. The parish, in collaboration with the technical team, has been advocating and going into the communities to educate and to bring across information pertaining to the transmission of the dengue fever. We have currently a total of approximately 40 temporary vector control workers who we have engaged, and they're going right across the parishes within our 4 health districts, seeking to educate and inform the public as to how best we address this issue that we're currently facing.
NERO in particular has been activated and is in high gear in dealing with the potential impact of dengue, and we are taking a proactive approach in looking at the communities, seeing where the vector sites are in particular, and how we are going to treat with and to mitigate against the outbreak. I mean, we are in a parish that has a lot of rainfall. We are in a parish that sometimes has regulated water systems, so people tend to store water. There's a recommended way to store water. I mean, the water must be covered. But the most important thing is that the emphasis is really on the individuals in their home. The government can do everything, the ministry can do everything, Ministry of Health can do a lot, but it really boils down to you in your home and the care that you take about your immediate surroundings. You know, get rid of everything that you do not need to store water in. Cover what you need. I mean, if you and periodically inspect these areas. Don't just wait to see mosquito, but you go around and literally look. If you have flowers, we call them flowers vase or vase. Look in them, throw out the water. If you store water, you see mosquito is breeding in there, and you can get fresh water, just throw it away and get fresh water and cover it. So the emphasis is really on you, the citizens, and we are hoping that the partnership that we have with the health department will make sure that we are dengue free, or if the incident comes, the amount is minimized in this particular area.
I'm now here in St. Mary with the health team, with the Member of Parliament, councillors, basically getting an update on the parish in terms of what is happening, what the number of cases are, and what is being done to deal with them, and to give some support to the team that are here so that we can beef up, if necessary, the activities in the parish. The status of the dengue in the parish is indicating an upswing in the numbers from December, and that increase has continued into January, into this month, 3rd week of January, with the 2nd week showing a spike and a slight decrease after the 3rd week, which is encouraging, but we can't get complacent. There has not been any deaths, fortunately, in the parish reported, but we have had, since the start of the month, I think it's 50 cases of suspected cases of dengue. The hospitals are treating with these cases. There is enough space, there is enough alertness of the doctors and the other clinical team members, and as a consequence, I think we're dealing with the situation very well based on the reports that I have. We have, in addition to the permanent staff, 40 temporary workers. We're going to be hiring some more. So all total, we should have about 50 temporary and permanent to move out in teams into the respective communities, the vulnerable communities, and to give support by visiting homes, inspecting breeding sites, providing advice. So my own assessment, having come to St. Mary, is that the parish is responding well in terms of the activities on the ground. The team is energized, they are equipped, and all that is needed now is to get our citizens to be alert, to inspect their surroundings for breeding sites, and to take the necessary precautions to control the virus. It really is a community effort. It's going to require all hands on deck. As I said, fortunately, there have been no reported deaths in the parish, even though we have seen some increases since December and January of this year.